I'm Elizabeth Bainkamp. I'm the social media specialist in UI Healthcare Marketing and Communications. Let's talk about social distancing. We all know how crucial social distancing is. It's one of the few proven tools we have for stopping COVID-19 from spreading. Social distancing protects our patients, our families, and our community. Let's also make sure we're using social distancing to protect each other. Everybody's busy, and when you're as busy as we are, it's easy to fall into familiar routines. Let's look at 3 ways we can break out of our familiar routines to protect each other and to be the world-class social distancers we know we can be. Who's hungry? We're all hungry, not just for food, but for a break and for the chance to relax and recharge with our friends. We can still do that, and we should still do that, but just a little differently than normal. See how they're keeping their distance as they wait in line and as they sit to eat their food? The 6-foot rule still applies even here. And here's the fashion tip. Face shields? They should be left on if you're grabbing takeout. If you plan to eat in a dining room, remove your face shield before you head to the cafeteria. When removing the shield, use the proper technique, leave the shield in place and lift the headband straight up and off your head, and follow the proper cleaning and storing guidelines outlined on the loop. Social distancing is not stopping them from enjoying lunch together. They can hear each other, they're making eye contact, and they're keeping each other safe. Well done, guys. Now, let's talk about social distancing in that place where nobody wants to make eye contact. If you're one of those hardcore stair climbers, good for you. Keep doing it. But we all have to cram ourselves into one of these eventually. The elevator is the nemesis of even the best social distancers. Still, we have to find a way to keep our distance, 6 feet whenever possible. In some elevators, 6 feet of space is hard to find. Use your best judgment and always be overly cautious. Resist the urge to be the last one to jump in. It's a good way to show people that you care about them and without any cringy eye contact. Wait for the next elevator. It'll only take a minute. Or take the stairs if you're able. Walking is good for you. You might even say that getting in a few thousand steps every day is one of the fringe benefits of working for UI Healthcare. Who needs a standing desk when you've got hallways like these? You can get a lot done strolling these halls with your teammates. It probably feels funny, but this is another place where we need to break out of those old routines and keep our distance, just like they're doing. If you can stay in your office or workspace, do so. If you need to be in the hallway, make sure you're spread out. Avoid walking in pairs or groups. And even when you're in motion, 6 feet as always. And watch out for those blind corners. At intersections and even when you're passing open doors, assume that somebody is just around the corner and be ready to let them pass. When you're on rounds, when you're headed to a meeting, whenever you're walking these hollowed halls with somebody else, remember, protect yourself and your colleagues by keeping your distance. If you see others standing a little too close, make sure you offer a gentle reminder of the 6 feet rule. Just say, I say it because I care, 6 feet apart. You're part of the team that's helping Iowans in their time of need. We're fortunate to have you here, and we want everyone to stay as healthy as they can be. Let's make sure we're taking every opportunity to put social distancing to work for our patients, for our loved ones, and for our team. We stand together, safely.